Okay, how are you? Good morning. Today we're going to talk about the implant choice. It's a really common question and it's not so easy to explain to the patient, so we will give the whole explanation today. How do you choose the right implant size for you? One of the most important questions when you decide to have breast surgery is what type of result you want. It is very common to receive patients who want breast augmentation but do not know how to tell us what type of result they want or the size desired. The size is very particular to each body structure, and we must know that it will depend on almost mathematical parameter. It is common for a patient to come and tell us, for example, I want a 300 cc's because my friend has it and I like it, or I don't want more than 350 cc's because my friend has put it and it looks bad on her. Tell them that the size depends on many factors, but the most important is the width of the breast parenchyma or the breast tissue. It might happen that you have a short height but your breast width is large, or on the contrary, you're a tall person and you have a narrow breast width. Choosing the size correctly will give us satisfactory results according to your wishes and your body structure. It is very important that you listen to your surgeon and what he recommends. If you place an implant that is too small for your base, the implants will be very separate. Or if you place an implant that is too large for your breast tissue, it will be too tense, hard and natural, and it will go to the sides. So we had some tests to decide which type of implant we might have. One is the RISE test. That's a very home test. This test can be done at home and give us a pretty good idea of the size of the breast implant. You only need to have grains of rice, a cup, a scale, plastic bags and a sports bra. For example, 29 grams of rice are the equivalent to 30 cc's of implant, or 142 grams of rice are equivalent to 150 implants. So it is possible to play with the amount of rice that is placed in the cover until the desired size is achieved. You can use it inside a plastic bag like a Ziploc and use it with a sports bra to test the size and the weight, and you see if you feel comfortable. The other one is the computer simulation. This can be useful to see an outcome, but it's not very good for lax skin patients or those in need of mastopexy. We use it only as an aid, but not as a sole method, because it's not 100% sure, and it depends on every patient to see if the result is similar to the computerized simulation. Another one is the implant test. It's the most simple. I usually do it in the consultation. It can be done at the practice with a special bra and some test implants to check the desired look and weight of your new chest. So in conclusion, choosing the right size for your implant is very important and has to be done together with your surgeon. You have to take your own body characteristics into consideration and decide the best size and projection. So now I'm going to talk about the TEPID method. The USA surgeon John Tebbets created a method called TEPID for implant selection. It is based on each letter, that is, for example, the T for tissue characteristics, the E for envelope of the surgery, P for parenchyma or the breast tissue and gland elasticity, the I for implant, and the D for dynamics. So this method addresses only 3 parameters to choose the right implant to fill each patient's envelope. So the base parenchyma is the width of your chest. The anterior pull is how much your skin stretches when you pull the skin. And the last one that is important is the areola or nipple inframammary fold to inframammary fold distance. So from the middle of the nipple to the inframammary fold, how much distance you have, and this will affect the implant size. The characteristics of the upper pole of the breast are controlled by the size of the implant, position and projection. An overfilled breast creates upper pole fill, but eventually more thinning and implant descent. Optimal aesthetics require optimal but not excessive fill. Inadequate fill results in less fill in the upper breast pole and more separated breasts. Excessive filling might create excessive fullness that might not descend over time, and the implants might look really high. less diameter than the gland with my resulting very separated breast, like I said before. We have a chart for each breast width or breast parenchyma width and an initial implant size, where we can measure and decide the right implant for every patient. For example, if you have a breast width of 13, the initial choice will be 325 cc's. And depending on your skin pull and your distance from the nipple to inframammary fold, that might change. So for example, if your anterior pull is less than 2 centimeters, the skin is not too lax and you don't have too much room, you have to subtract 30 cc's of implant. If the anterior pull is greater than 2 centimeters, you can add 30 cc's of implant. If it's greater than 4 centimeters, you can add 60 cc's to the implant size. In the nipple to inframammary fold, for example, if the distance from the nipple to inframammary fold is greater than 9.5 centimeters, you can add an additional 30 cc's. So it is a great mathematical aid to choose the right implant based on every patient characteristics and not on anything else. Once we have decided the approximate size, we can choose between the projections and the type of implant based on the patient's choice. Moderate implants for a more natural look, high profile for a more cleavage, and extra ultra high profile for a porn star look. Lastly, if you want a more natural result, you can choose an ergonomic implant. Those implants are filled 80%, so they are more teardrop shaped and are used in thin patients. So thank you very much. If you like our video, you can leave in the comments. You can write us if you have any other doubts that I haven't speak on the video, and we can answer in the following videos or the stories. Thank you very much.